cuts to Medicaid.
No cuts to Medicaid.
Healthcare is a human right.
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 Healthcare is
a human right.
Healthcare is
a human right.
Healthcare is a human right. Healthcare is
a human right.
Healthcare is
Human right.
Healthcare is
Human right.
Healthcare is a
Human right.
Healthcare is
Human right.
Healthcare is
Human right.
Healthcare is
Human right.
Healthcare is a human right. Healthcare is
Human right.
Healthcare is
Human right.
Healthcare is
Human right.
What do we want? Healthcare. When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
Kill the bill!
Kill the bill. Kill the bill. Kill the bill. Kill the bill. Kill the bill.
Kill the bill!
Kill the bill.
Kill the bill!
Kill the bill. Kill the bill. Kill the bill.
Kill the bill!
Kill the bill.
When healthcare is under attack, what do we do?
Stand up like that.
When healthcare is under attack, what do we do?
Stand up like that.
When healthcare is under attack, what do we do?
Stand up like that.
When healthcare is under attack, what do we do?
Stand up like that.
When healthcare is under attack, what do we do?
Stand up like that.
When healthcare is under attack, what do we do?
Stand up like that.
When healthcare is under attack, what do we do?
Stand up like that.
When healthcare is under attack, what do we do?
Stand up like that.
When healthcare is under attack, what do we do?
Stand up like that.
When healthcare is under attack, what do we do?
Stand up like that.
No cuts to Medicaid.
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 Healthcare is a human right.
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 What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
Kill the bill!
Kill the bill.
Kill the bill!
people. Kill the bill. Not the 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 people.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
No cuts to Medicaid.
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 We will not be silent. Denying care is violence.
We will not be silent. Denying care is violence.
We will not be silent.
Denying care is violence.
We will not be silent.
Denying care is violence.
We will not be silent.
Denying care is violence.
We will not be silent.
Denying care is violence.
We will not be silent.
Denying care is violence.
We will not be silent.
Denying care is violence.
We will not be silent.
Denying care is violence.
We will not be silent.
Denying care is violence.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
When health care is under attack, what do we do?
Stand up, fight back.
Health care is a human right. Health care is a
Human right.
Health care is a
Human right.
Healthcare is a human right. Healthcare is a human right.
Healthcare is a human right.
Healthcare is a human right.
Healthcare is a human right.
All right, now make some noise when we get this started here.
Yay! You can only make noise for so long, but I can make noise for a long time!
Way to go! Thank you everybody for coming out today to help protect health care here in Jackson and around the country. I'm really thankful for everybody for coming out today.
Woo!
I know it was really short notice. Health care is a human right. And everybody here and everybody across the country deserves health care. My grandfather used to say, as long as you have your health, you have everything. And if everybody in this country cannot get health care, they cannot have good health, and they cannot live the life that they should live.
That's right, that's right.
There are things in this world that should never be privatized, and that includes health care.
That's right.
We should not be making a profit off people's illnesses and injuries. That is morally and ethically wrong. And this country should be better than that.
Yeah.
I want to introduce our first speaker tonight, Sybil Colin. She's a member of Indivisible. Come on up, Sybil.
All right. Hello, everyone.
Hold that out.
Thanks. Thanks for being here. It's really great to see so many people. Again, my name is Sybil Colin, and I live in Manchester Township, about a half an hour southeast of here. I used to work up the street at the state office building for the Department of Environmental Quality. I was fortunate enough to be able to retire a little over a year ago, and I'm also very fortunate to have a pension and health care retirement, which I'm hoping will continue. But I certainly know people who have benefited greatly from the Affordable Care Act. One of those people is my sister, who was adopted by my parents when I was 13 years old. She was just a baby. And in adulthood, she developed two conditions that were quite debilitating. This was about 15 years ago, and she had moved down to Florida with her husband, and they were definitely struggling. They did not have health care, and she had very, a lot of expenses, and they basically, between that and the Great Recession, they nearly went bankrupt. But fortunately, the Affordable Care Act came along and allowed her to get the treatment that she needed so that she could become more of a functioning member of society, because her pain and suffering were under control. And after the election in 2016, she and her husband began looking to see what state they might be able to move to, even such as Washington State. They're currently in Florida. So that, fortunately, we've been able to hold off the repeal of the ACA, and we're here today to make one, hopefully, final stand to convince our legislators that they need to work together in a bipartisan way to improve the Affordable Care Act and make it more available instead of less available. So again, thank you for coming, and I know you all have your own stories, but it's very important, and that's why we're here. Thank you.
Thank you.
Next, I'd like to introduce our next speaker, Emily Sapola, who's going to tell us her story.
Okay, this is working? Okay. I'm Emily, I live in Ann Arbor. I brought some small people with me today. Thank you very much. I'm sorry that we have to be here again today for this. I don't think any of us want to have to be here right now with the zombie bill that keeps coming back over and over again. I know I was at Wahlberg's office here back in May. In July, when things were blowing up with the iterations of this bill, I was actually at a volunteer leadership training for an organization called Living Beyond Breast Cancer out in Boston, because I'm a breast cancer survivor. I was diagnosed at age 35. And in 2016, I had 3 different health insurance plans because I lost, well, first I was divorced and then I lost my job. So I had an employer plan through my spouse, and then I had my own employer plan. And then thanks to the ACA, I was able to purchase insurance in an off-exchange program that covered all of my breast cancer care, covers my care for my inflammatory arthritis, it covers all of my care for my complications. And I feel incredibly lucky, because 10 years ago that might not have been the case, that I could purchase insurance, that I could afford insurance. But thanks to the ACA, I've been able to be covered throughout this time. Healthcare is really important to all of us. It's really important to me in large part because I've got these 2 recalcitrant children over here who it means you'd rather not be here. Because they don't really appreciate how lucky they are that we have the right to protest in this country.
I don't like protesting.
For as long as it lasts, we do have the right to protest in this country, even though not all 4th graders appreciate it.
Sorry, I'm just gonna score.
No, that's great. I'm glad you're here. So, you know, we have been dealing with this bill. We've been dealing with all of the iterations of it. There's a lot of disagreement, in large part, about what to do about healthcare but there's very little disagreement that what our Republican legislators have been doing is not appropriate, that it is not okay, and that all of the limits to healthcare that that have been thrown at us are unacceptable. Organizations across the country, hundreds and hundreds, probably thousands of professional organizations have been coming out against this bill. I probably don't need to tell y'all how important it is that we stand up against this.
Yeah.
Thank you, Emily and Sybil. It is sometimes hard to get up and tell your personal stories. Those personal stories are really important to make the point how important it is that each of us have health care. And we all need to remember that we have not beaten this bill yet. There are 2 people who said that they are against it. We need another. They're on the fence. We need to fight, and we need to fight hard. Because I also have a personal story. I have 2 sons who might not be here today if it weren't for the ACA. Up until they were in their early 20s, they were very healthy kids. Never had any health issues. Unfortunately, due to circumstances in our families, they both lost health insurance. And they both suffered major medical issues that required surgery that we did not have the money to pay for. Thankfully, due to the ACA and the Medicaid expansion, both of my sons were able to get the care that they needed. Had that not been available to them, I might not have my 2 sons today. This is personal. This is human lives that will be lost if we let this go through. So thank you all for being here today.
We will protest, we will fight. Healthcare is a human right. We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare
We will protest, we will fight.
is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
She always is.
Healthcare is a human right. 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 Stand up, fight back. 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 Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
No cuts to Medicaid.
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 We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
She always is.
Healthcare is a human right. 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 Stand up, fight back. 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 Healthcare. Now. 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 Healthcare. Now.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
No cuts to Medicaid.
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 We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.
We will protest, we will fight.
Healthcare is a human right.